The center has been thinking of providing a platform of conversations on difficult topics to provide a safe space to talk about physical, mental, and social health in a positive way, especially at a time when we are facing a variety of adverse conditions out there, whether it is climate change or racism, poverty, inequities, wars, conflicts. So how do we have that kind of conversation on difficult topics in a safe space? So we thought of organizing an annual symposium. And as we began to organize this symposium, we thought of Dr. Chester Pierce, who was a psychiatrist, a professor at Harvard, who was also associated with our department at the Harvard T.H. Chan School of Public Health. He's one of the few Black psychiatrists who faced adverse circumstances himself, but flourished and thrived. And one of the few people who talked about virtues such as gratitude, empathy, kindness, in addition to working and advocating for civil rights and mental health. So we couldn't think of a more appropriate name for this symposium, and that's how the Chester Pierce Symposium emerged. We wanted to bring in both a mixture of researchers, advocates, activists, and policy-oriented people together. The speakers and the panelists today reflect that broad background.
From the other speakers at today's symposium, I learned all about the social drivers of health, everything from the way racial inequities affect our health to the way concerns about the climate affect our health. And what I really see is this common theme of the need to invest in community supports to address things that might not seem like they're connected to health as a preventative measure.
The biggest takeaway that I would like people to have from our panel today about flourishing amidst climate change is the importance of organizing at the local level. We really need to lean into community when it comes to impacts of climate. And we also have to understand that a daily practice of sustainability can help ease our eco-anxiety and create the culture shift. We need big solutions to work.
Resilience has always been important, but in today's environment, it's especially important just because it seems like our community in general, the society community, has fractured somewhat, and that people are struggling more than they have before. Helping them with their resilience and their ability to cope as best as we can as an employer helps people not only within their work, but within their lives in general. If they can feel like they come to a good place to work where they are supported and appreciated, it helps them in their everyday life and helps improve their resilience.
The key theme really focused on working conditions, that worker health and well-being matters in terms of the work that is done, the way work is organized and structured, the types of policies that workers face in their working lives. And the question then becomes, how do we change those conditions of work in order to improve worker health outcomes, addressing in that the root causes of well-being.
Every single person can think to a time in their life where it was hard. And so what was it that was drawn on from within, the strengths that were drawn from within, the relationships that we relied on external to ourselves that helped kind of get us back up again and going, I think is the ultimate example of what resiliency, right? The resiliency is not like beating somebody up until they fall, but it's the capacity and the strengths of individuals and communities that help people get back up again and continue on.